Well, hello, everybody. Good afternoon or good morning, depending on where you are in the country. My name is Garrett Schmidt, and I'm the managing editor for VBC Exhibit Hall. And I'm glad you joined us for today's live webinar hosted by Lucerna Health. And it is called An Inside Look, the Formula for Health Engagement and Revenue Growth. And very excited about the topic today. And we've got a big audience, so excited to share this with you guys. A few items of note before we get started. This is a traditional webinar format, so everyone has joined today in listen-only mode. So you don't need to worry about muting your microphone or turning off your camera or anything like that. We can't see you or hear you, but we do want to hear from you. So we are going to have a time for some Q&A towards the end. So if you have a question at any time during the presentation, go ahead and ask it and drop it into there's a little module that you have as an attendee that you can put your questions there. And we're going to get to as many as we can in the allocated time that we have. And so even if we're wrapping up at the very end, go ahead and drop your question in, because if we don't get to yours for some reason, someone will reach out to you via email and we'll make sure to answer your question there. So uh, also wanted to let you know that the session today is being recorded. So what's going to happen is when we conclude, you'll receive an email about maybe an hour or so afterwards, and there'll be a link to the recording as well as to where you can download the slides from today. And that way you can rewatch it at your leisure or share it with colleagues and friends. We hope that you do. And finally, wanted to, without further ado, briefly introduce our speakers today. And we have with us Mr. Craig Thomas, and he is the co-founder and CEO of Lucerna Health. And we also have Lynn Locke, and she is a Senior Director of Consumer Engagement and Insights. So welcome, Lynn and Craig. There they are on the screen there. And we're actually going to get started this morning with a polling question. And so what we're going to do is, this is anonymous, of course, but we're going to pull it up and you can answer it, and we're going to share the results. And this way you can kind of see where you stack among your colleagues. And so let's see. Craig, did you want to introduce the polling question?
Yeah, I'm waiting for the screen to change here. But
There it
first,
is.
Garrett, uh, thanks so much for having us again on the VBC Exhibit Hall. We appreciate your support. We had a session with you in Q4 last year with Dr. Juan Estrada from Sanitas USA, talking about how we work with providers and payers in integrating things. I think that's still available for folks if they want to see it. But today we're going to go much deeper into consumer engagement. And Lynn's a true expert, so I'll try to get to her fairly quickly, so you can hear what we've learned over the years in doing this. But so there's two poll questions here that you can respond to now. One is, from where you sit in your company, what's the highest value opportunity that consumer engagement can impact? Is it acquiring and retaining new health plan members or patients for a hospital or provider? Is it engaging your consumers in their healthcare, let's say a visit? Number three, is it navigating consumers either across your health system or to a strategic provider or a preferred specialist? And last, is it improving Net Promoter Score and consumer satisfaction? And we'll
Great.
give a couple minutes, right, Garrett, for people to
Yeah, that's right.
respond.
So yeah, go ahead and respond. This is, I believe, a select one that most applies. And for those of you who are just joining us, we're doing a polling question, and these are anonymous. We'll show the results here in a minute, so you can kind of see where you stack among your colleagues. And the question is, what is the highest value opportunity for your company? So we still have some results coming in, and we'll give it maybe 10 more seconds or so, and then we will share the results with you. Okay, I think most of the results have come in, so I'm going to go ahead and shut it down in 5, 4, 3, 2, and 1. All right. Craig, are you able to see those results on your screen?
I am. It's interesting. Almost each person almost voted for either acquiring and retaining members or patients or engaging consumers in their healthcare. A little bit on NPS and satisfaction, and not much at all on navigating consumers to preferred providers. So, I think it's not overly surprising. A lot of companies are, in growth mode or trying to increase revenue. And, getting appointments in for visits, whether it's fee for service or value-based care is, pretty important, particularly what we would call priority consumers who have high needs, high costs, need a lot of support. Getting them engaged is pretty important to impact things. So, um, pretty interesting. I don't know, Lynn, if you see anything in there that jumps out uh, for you.
Just surprised it's a tie.
Yeah, it's exactly a tie. Yeah,
Yeah.
I really thought it was going to be about engaging consumers in the healthcare.
yeah,
So
yeah.
but we have a lot of experience on the acquisition and retention of members and patients as well. So I think it depends on which side of the business you work on.
Yeah. Okay. Well,
All
thanks
right.
for that, guys. So let me just take 1 minute or so to introduce Lucerna. We know there's some folks on the call that know us, and a lot of people who don't, and we hope to get to know you better down the road. So just a minute on Lucerna. So on the left here, this is how we see one of the major marketplace kind of strategic trends that we are excited about. And it's really companies, generally forward-looking companies, which is why we really like to work with innovators that are trying to drive change and make an impact. And you see it in a few different ways. One, hospitals expanding into ambulatory lines of business or becoming a health system, to diversify revenue, prepare for value-based care, those kinds of things. You, you see health plans acquiring, say, primary care physicians at a very high rate, and integrating them or doing joint ventures. We have a lot of experience in that area. And primary care, connecting better with specialists for value-based care. So along with health consumerism and value-based care, these are trends that we have kept our eyes on as we've built our company. Moving to the right, just give you a quick view of our products and services. Everything that we do, and we'll talk about this quite a bit today, is driven by our LEAP platform, which roughly stands for Lucerna Engagement and Activation Platform. It's a data management platform for healthcare. It's analytics and insights, and it's integrations of processes and companies. And then around the horn are where our software applications and our services come into play. Today, we're going to focus on, kind of the top around to the right, consumer acquisition, navigation, a little bit on integration and patient engagement, of course. Provider engagement and provider performance are also critical to close that loop and get the results you need, but we'll focus on the consumer side today. So that's how we look at the market a little bit and our products. And then one more slide. This is I guess, the high level architecture, I guess you could say, of how we think about strategic engagement. Across the top there, first you've got to get your data together. It's hard, but essential. Then you got to turn it into, actionable, trusted, accurate, deep insights, and then connect it to processes. So just a second drop down here. To do this the way we're going to talk about it, you need clinical data from the providers, typically from their EMR. You need payer information like rosters, eligibility, claims, things like that. Pop health outputs, who's sick, who needs care gaps closed, those types of things. Consumer touch points, if you're sending emails, text messages, getting that data out through your channels and then back into your analysis. And then operational systems such as, your your CRM system or something like that. The middle is the big machine. This is where the data is ingested, secured, enriched, normalized, all those kind of data techie type things. The key, though, I think for this topic is you have to have a very deep and broad usable consumer 360 database, and the same for your provider database. Patient attribution is helping you align patients with the right provider based upon needs and providers' availability and skills, so forth. Then you need the analytics. We call this smart engagement because it's driven by data and analytics. And then, you connect it to processes like, let's say, the digital front door, your websites, your patient apps, your member applications, drive it through your growth engine and so forth. So those to us are the three big pillars, I guess, of activating strategic engagement. And that's how we kind of operate. Okay, so that's it on Lucerna Health. We're going to drop now into the deeper into the content. I'm going to spend a few minutes on how this drives value and what some of the numbers are and the opportunities. A little bit more on how to look at this longer term from a strategic standpoint. And then Lynn's going to go deep into each component of the tips and tricks we've learned in doing this for, well, really decades, but in Lucerna the last 6 or 7 years. Okay. The slides are a little bit slow. Okay. The engagement challenge. This could be called the engagement opportunity, but first, and I think most everybody on the webinar probably knows these things, but patients expect more and better engagement. They'd like to have an experience a little bit more like retail or finance. Healthcare is pretty far behind in a lot of ways. They expect personalized messages, not generic, blasted, messages that don't really apply to them. They want more engagement. We'll talk a little bit about that. Of course, reputation of your company in really the digital world and word of mouth is critical. So paying attention to patient experience and things like that, which we do a lot of work in that area, is pretty important. Patients will shop online and they will shift to a different provider if they're having a negative experience or an inconvenient experience. Of course, digital engagement's undeniable. Everybody's using digital, even older folks. I'm not quite to that cohort, but approaching, and everybody's using, their phones. And then the business impact is clear. I'll show you some more numbers here in a minute, but if you just take one, provider appointment slots not used. So let's say your PCPs can see 15 to 20 a day and they're seeing 10 a day. On average, more than 35% of slots are not used. Some of that's just not used, some of it's no shows. And that's costing or contributing to the cost of PCPs for hospital systems, for example, losing $1.5 billion or more a year on their PCP investments, typically about $250,000 per primary care physician per year. And then you got leakage. And, for hospitals, this means patients that are referred by their PCPs are not using their system, their diagnostic clinics or surgical centers. That's a top priority for almost every hospital. And the same could be said for a payer if they have preferred networks or providers that are not getting care within the network. So that's the challenge or opportunity. It's pretty big opportunity. The last thing on this little chapter is, what are the use cases? Well, first of all, if you have the data and an imagination, you can make a business case for anything that's going to drive any kind of value. And a lot of these use cases are known and they're applicable in one way or another for a payer and a hospital system and a provider. There's a lot of commonality in how you drive value. It's a lot of who's sending the message to whom. But you have a whole bunch in the growth area, healthcare engagement, the two top ones. One question or option in the poll wasn't operational performance, but there's a lot of things you can do to drive efficiencies. and in tight margins, uh, avoiding calls to a call center because you can drive them to your website, things like that can make a big difference. So, these are some examples. And we've built a campaign catalog, kind of an end-to-end program around 40 or 50 different use cases that we use pretty much every day. Okay, now the last piece in this chapter is some examples. And of course, these are illustrative. They'll vary quite a bit by your circumstance. But a couple here on the left for a hospital system. If you drove one more visit a day across 100 PCPs, that's worth about 4.5 million in new revenue a year. And if you have capacity, that's with minimal new expenses. You have the facilities, the equipment, the providers. You're just using, unmet or available capacity. On the systems leakage, same 100 PCP hospital reducing leakage from 55 or 65%, just down 5%, depending on their mix of, other ambulatory business lines or service lines. It's another 4.5 million. So that you're talking about, pretty big money here without huge lift, not anything that's unachievable. And then just one on the payer side, Medicare, I always used to say it's like selling a, BMW or something. If you acquire a new MA member and keep them for 6-7 years, which is typical, that's 72,000 in lifetime revenue. So when you're looking at investing in this true database marketing for healthcare capability and teams, this is your business case. And depending on your circumstance, you can really drive big value and get a lot of support inside your company. Okay. So hopefully that's makes this worth it. This is a little frame. Now we're moving to kind of a strategic view of this, what it takes. This is a Gartner view, and it's showing as you move up the data maturity and across connecting your touch points. Oops. Yep, there you go. So basically this is saying first, get your data and your act together inside your own company and get things coordinated and smart and scaled. Second big step as you mature is that data includes activities outside your company and touch points outside your company. So it's more of an ecosystem view that we were talking about earlier. And in Gartner's study, once you get there, you can have a greater than 20% increase in revenue and efficiency. But this little picture here, going from left to right, it takes a bit to probably for most places a multi-year journey to really get that right, depending on how complex your company is. Okay. All right. When you work in a company that has software products, you get these very detailed requirements and very detailed capabilities. But I always like this view of it from a kind of a plain language business point of view. What do you need to do from a requirement standpoint to have a comprehensive approach? First, you have to know everything there is to know about the consumer. That's a data and analytics kind of thing. Same thing for the provider. Their operations, their capacity, what types of patients they focus on, all those kinds of things. You have to know if you're going to match patients, what's the right provider for that patient based on their preferences and the provider's demographics and so forth. Then you got to get them in either to a visit or to join a care program or to use a patient app or go to the website, follow up on a referral, fill their prescriptions. You've got to get them engaged in there. And then, as I mentioned, the providers have to be aligned and know, you have to present this information to the providers so when the consumer presents, they know why they're there. So what do you need then from a capability standpoint in your company or with your partners, however you decide to attack this? One, you need the insight that I talked about, and it's got to be presented in a way that the marketer can use it. You really need a team that has a lot of expertise. And we may talk a little bit more about this because it's a question that's often asked, what kind of team do I need here? But they have to know payer provider business, they have to know healthcare data, and they have to have data and technology really, and they have to have database marketing expertise. Hard to find it. Usually it's a multidisciplinary team, approach. The catalog, you build them out, you test, you fix, you improve. You need to connect it to the operations, and then you need to monitor performance, test and learn and improve. So that's really what you need at the simplest level that we could think of sharing. So I think that now takes us to the second poll. I appreciate everybody responding to the first one. So what do you see, maybe personally or in your company, as the biggest challenge to engaging members or patients in their healthcare? Is it a lack of interest or motivation on the consumer's end? Is it they don't have a relationship with the healthcare provider? A lack of relevant, personalized communications to help them out? Or is it just they have a hard time accessing and navigating the health system? So we'll give you a couple minutes here to vote. We appreciate it.
Great. Yeah, and we do have a number of results coming in. So, and again, just to remind those of you who are coming in a little bit later, we have a couple polls here, and this is completely anonymous. So go ahead and feel free to participate. And we're going to show the results here in a minute, so you can kind of see where you stack among your colleagues, and it's kind of an interesting show. And then we'll talk about the results a little bit. So we've still got some results coming in. We're going to give it maybe another, slow down a little bit. It's another 5 long seconds here, and then we will shut it down and show the results. So we'll go ahead and close it down in 5, 4, 3, 2, and 1, and I will share those results now. You should see that on your screen. All right, Craig, you seen it?
Yeah, this one's a little more, the last one was pretty heavy on 2 of them. This one's more split across 3 of them. And I think they really reflect a general state of the healthcare industry as opposed to an operational view. With all the churn in the system, all the social determinants of healthcare, all the fragmentation and complexity, people are busy. They have other things going on in their lives besides, thinking about what we all think about. So it's pretty evenly split there. I guess a little heaviest on access and navigating the health system. Of course, that varies a little bit by, what market you're in, what kind of health product are you in, do you have access to some place like Mayo where, they do a pretty good job in navigating you within their system. So interesting, and we appreciate the response.
Yeah, and real quick, just if any of you are calling in and watching this later, the responses are: we had 24% at the lack of computer or consumer interest, 29% lack of a relationship with the healthcare provider, 6% lack of relevant personalized communications, and 41% the challenges accessing and navigating the health system. So I'm going to go ahead and close it down, and we'll go back to the slides.
It's even hard to say some of that, let alone do it.
Yes, it is.
All right, Lynn, all yours.
All right. So the secret formula. So, it's the actual real secret is it's a lot of hard work. But in terms of all of the things that have to happen, we've got to start with a great plan. We have to know objectives and what you're trying to achieve, create a strategy to get there, and continuously monitor the results so that we can optimize as we go forward. But underneath all that, we have to have the data in place. It needs to be actionable. We've got to have a lot of the data mining, the learning, the segmentation. We need to make the data easy to use and get some of those audiences predefined. As Craig mentioned, there's a lot of different skill sets needed. So the more we can fix some things up front in the process, then the easier it becomes for the marketing team, the database marketing team, to really execute upon those. And then the communications, there are a lot of different campaigns in the catalog that Craig referenced. And so we really need a way to do mass personalization to make it scalable. So you have to be able to scale this up. A lot of different competing priorities, a lot of different patient needs, and we've got to be able to get the right message out at the right time through the right channel. So all of those journeys, and this is not a I'm going to do a campaign and see what happens. I'm going to do a lot of campaigns. I'm going to take patients through a journey to get them to, meet all the goals and objectives that we have for the company. And then we have to continually measure and optimize along the way, so that we can correct course, change up communications, what have you, so that we're continually improving. But one of the really important things you'll see here at the bottom is the operational integration. And that comes into play when we're talking about the patient or the consumer and on the provider side. So if I'm trying to engage you in healthcare, I need to make sure that it's the right time to send the patient a message, and that the provider actually has the capacity to handle the responses from that. So whether that's a call center, appointment availability, et cetera, all of those things need to come together to really make it work well. And so what we'll do is we'll kind of go into each one. Each one of these will become a separate page. And so we'll just kind of walk through those. So let's talk about the integrated data piece. Awesome. So what you'll see in here, there's really two sides here. And one says patient all the way around, but the other one says provider. And it's really the integration of all of that data that comes together. So as I said, we're talking to the patient for the most part, and we're trying to get them to take action. This is database marketing. So we're telling them what we want them to do. We're trying to get them to take action, but we only want to do that if the operational side, if the provider side can actually handle those things. So if I need a wellness visit, but my particular attributed provider doesn't currently have capacity right now, I might not want to send that message. So that might not be the right message at the right time. There are a lot of other messages that we may need to talk to, but it's the getting all the data together. And as Craig mentioned, all of the data sources come from different places. So you have to have the ability to standardize it all, bring it all together at the individual level. So all the disparate data sets can be matched back to the same consumer, and we have all that together. And then on the provider, the attribution side, we have to make sure we understand capacity. We have to understand the contracts. If the patient has insurance, then we want to make sure we understand the relationship and all of the things that go with that contract, if it's a BBC contract, if it's a fee-for-service contract, et cetera. So we need to bring all those things together. And this, the little library here on the right-hand side, this is actually a look into the LEAP system, the LEAP platform, in terms of these are all the different types of data that we have available, and we'll go through, and organize all the data in a meaningful way so that it's fairly easy for the marketing team to be able to pick up and be able to understand how to bring it all together for any particular patient. All right, let's talk about segmentation and prioritization. So in the world here for the segmentation and the prioritization, we have to take all of that data we have and make sure it turns into actionable data. So yes, there's a lot of sources. We've got them all everywhere, and we have to make sure that for the marketing team, we can turn these into very easy to use types of data that will allow us to easily pull together a campaign. So the segmentation, cohort development, a lot of the heavy lifting of, deciding who needs to be in a particular care program or who needs education, et cetera, all can be done ahead of time. And so within the campaign, we have the cohort already built and ready to go. So it's a matter of finding all of the people that qualify for any type of campaign that's in the catalog, and then being able to prioritize all of the campaigns that they may qualify for in order to send all of those things out on a regular basis and make sure we're we're not over communicating or under communicating, but we're getting the best message out at the right time and based on the needs of the patient. We have to make sure that we get all of the messaging timed appropriately, and we focus on the priority patients. So if we have chronic patients, oops, we lost our screen. If we have chronic patients, then we need to make sure that we're caring for those in a very efficient manner.
We're working live, folks. We've got, we'll get the slides back
So
up here shortly.
it'll come back in a second. But getting all of the people and everything, if you will, predetermined in terms of what we're going to do, a lot of that heavy lifting can happen within the database, within the LEAP platform. And so when it comes to the campaigns and the communications, it becomes much easier to do the appropriate targeting. And then once we have all of those, if you will, target lists of all the people that are qualified for the campaigns, one of the really important things for us is to be able to create mass personalization at scale. So because there are a lot of different campaigns, it's not just a one and done. We have to be able to take all of the, I'm going to call them templates, maybe they're not exactly templates, but all the templates of the communications and create those in a dynamic way that allows us to give a personalized message to each consumer that we're sending out. So sometimes with these communications, if you look at all the different variations, there may be thousands of variations and they get generated on the fly as the campaigns are executing. So if I have, this template here on the left, all of the data that's in there, the copy, the buttons, where the calls to action go, the URLs behind those, the personalization of the provider, the assigned provider, all of that gets dynamically generated based on all of that data that we have in the database. So depending on which cohort you're in or which segment you're in or which provider you're attributed to, or how we want the operations to handle the calls. Do we want it to go to a clinical care team if I ask you to call? Do we want it to go to a regular call center? Or do I really want to get you to book this thing online? So all of those things come together to create these communications in a very scalable way that enables us to be able to send all of this stuff out without, having a huge staff to accomplish that. So if we can utilize the templates, we can utilize the insights that we have from the data, we can pull all of that stuff together. And especially if we're talking about, a person's assigned provider and we have lots of offices across lots of states, we may have to personalize for the payer that's involved or for the individual provider. And so all of those things can be done in a scalable way that will allow us to give the right message to each of the consumers and to get them to the right channel. If they're chronic, we may want them to call. If they're non-chronic, we may want them to book online. So all of those different things can come into play as we get that information together. All right. And then we can talk about the journeys here. So yeah, it looks real simple here, but there's a lot of stuff that goes into these journeys. All this data we just talked about has to come together in these campaigns and be dynamic and relevant and timely. And so what you're looking at is actually a flow of an audience that we have. But the thing about these audiences is that they don't just go one time. They are set on a schedule and they trigger. And every day as these things run, or it could be every hour, however often your data updates. It could be weekly, whatever. Every time these audiences run, you're evaluated at that point in time as to whether this is a good time to send you a message or this message. And so in this particular example, we were really looking at, a pre-built cohort that we put together. And in this case, in the example, we had 20,000 people that qualified for this particular campaign. But what we didn't have was the available provider capacity for this particular client to send them all a message. So there were some providers that didn't have availability within the upcoming, say, week or two. And so we held those back. And so all of these things go into the campaigns so that we're sending the messages, but they're triggered, they're sent on a regular basis, and they're sent through the appropriate channel based on preferences and channel prioritization. Even if you prefer email, I know text message is going to perform better. So there's a balance in terms of which channels we use for when and for which campaigns. And those are things that we test and learn all throughout the process. But these campaigns, like I said, would run on a triggered basis every day. And if you qualify for that day, you'll get the message. If you don't, you'll wait until you do qualify again. So some of these messages are, we might want to do a campaign and we only want to get people to book online. So if we only want people to book online, we want to make sure we know who your assigned provider is, and they have online booking, and they have availability, and all of those things have to be true. And if that's true, then the message is relevant for you in that particular time frame, and so it will get sent out. If it's not, you might have to wait a day or a week, before that message will get sent out to you. So these are things that just go on over and over. It's very repeatable and it's very scalable. And at the end of the day, I mentioned, the scalable creatives on the screen before. And so when you get put out into your particular channel, then your offer that comes out of this campaign is going to get personalized based on all the things that we knew about you. And the thing to know about the actual stuff that we're sending out, we do direct marketing. So it's important that as we're doing all of the communications, we're actually telling people what we want them to do. It's not an exercise of just education. It's an exercise of is the thing we want you to do, and we're going to make sure the message is concise and clear, and it has call to action, and we're sending you to the best place, both for you and for operational purposes. All right, so the analysis and reporting. So the thing about the analysis and the reporting for us is that it's ongoing, and it's not operational, it is performance tracking back to the campaign. So if my campaign is trying to get you to schedule a visit, then the metric that I'm going to measure for these campaigns is whether or not these campaigns generated visits. Okay, if it's to get a survey done, it's going to measure whether or not surveys were completed and what were the conversion rates on getting surveys done, et cetera. And so it's not just open rates. It's just not, click-through rates. None of those things are important to keep going. But in order to really understand and optimize the campaign, we do quite a bit of analysis on all of the campaigns that go out, operationally and closed loop, to keep all of the channels healthy. That's a big deal to make sure our channels are performing effectively, but also to match the people and the offer back to the behavior of, was an appointment scheduled? Was an appointment completed? Was a survey completed? How did the survey, how was the NPS score? And then what do you do with that? So all of these things we're monitoring on a continual basis. And as we see issues or areas for improvement, we're optimizing either the channel, the creative, or the audience to make sure that we're getting the best performance we can out of each of the campaigns. All right. So in the results, so this is a model that we use, kind of the life cycle of the patient. And this is where we talk about it's not just operational metrics, it is the closed loop marketing metrics that really matter for us. And so, we some of these, depending on our client, they may have a list of patients that they got from a payer, but they don't really have a relationship with the provider yet. And so a lot of awareness activities have to go into play to get, the brand awareness and get that initial visit. And we have campaigns to support all of those, which we're monitoring or measuring visits. And then once we get through a visit and we've established a relationship, then it's all about the care journey that we're going through to make sure we're helping the client meet their goals, whether it's quality, care gaps, VBC goals, et cetera, access metrics. All of those campaigns are put in play, and we're monitoring each one of those individually. And then we also have, for all the patient loyalty and retention stuff, same thing. So we are making sure that campaigns are happening to retain patients, to win back patients. All of the things come into play. And when we measure, we're measuring to see how many people did come back. So it's a pretty heavy lift on the data and analytics side once we get to the actual reporting piece, but it really makes a difference in terms of how all the performance works out for us. And as an example, from our client, this is an example of one of our clients' results, but I'll direct you to the chart on the right here. And for this one, it really is about the lift. So we took a look. We do measure each campaign's conversion rate, and you'll see those on the left-hand side. But we also take a look at, if you will, that control group of people who we didn't communicate with versus the people, the patients that we did communicate with, and measure the lift between the two. And it's pretty substantial for this particular client in 2023. For the seen rates. So we're doing make sure we have our access metrics covered and all the patients that need to be seen get seen. And we took a look at the patients who had campaign communications, and 46% of them did get seen versus those patients in that control group who did not get any communications, and that was 15%. So we had over a 200% lift for getting people in for their visit for that. And that's the general population. When we go down another level on that population, so the chronic patients that you see at the bottom really are a subsegment of the larger patients. Because they're chronic, they need a lot more care. But what we see there is that we still got an 83% lift. So for chronic patients who weren't getting communications versus those who were, the difference is also pretty huge. And that's really where, the providers can really impact the MLR and their BBC metric goals, et cetera, is by moving that chronic population. And so a lot of the campaigns that we do really focus on the priority patients that really do matter and make a big difference in the metrics and the goals for each of our clients.
Yeah, Lynn, I think this piece on the right highlights a couple things we notice with client organizations. First, having good emails, good phone numbers, and opt-ins is important. Otherwise, you can't communicate to them digitally anyway, and you're left with inefficient phone calls. The second thing is having the capacity and the easy booking experience, because you can, get a lot of drop off, I guess, of your visits if you don't have that operational process and capacity and all those kinds of things in there. So if you think about the totality of all the things that has to go on in the data world, the operational world, and the marketing world coming together to get, kind of the bottom line results, it's a high value process, but as Lynn said, it takes a lot of work across the organization. But there could be huge payoffs, for your company and things like that. So just to wrap up, and then we'll open it up for questions. And this is coming back up a little bit. Having been involved in building these kinds of things in multiple companies, um, the first thing is try to start with the vision across your ecosystem. Most companies, you can't pull this off by yourself, whether you're trying to grow your health plan or win in value-based care. There's other companies and vendors and partners and so forth that are in the mix. Second, I always think of, for a lot of organizations, a focus on the consumer is different. It's transformational, whether it's the mindset, the processes, because it's either, a risk management focused company, a clinical focused company, sometimes, operations, finance, but a lot of healthcare companies haven't grown up with really, honest to God, consumerism, or the consumer at the center. That's what you need to think about, is how do you really change things to work for and this can be a big catalyst there. The third one is, this is an execution journey, you know, both building out the capabilities and processes and technology, but also operating it. And so you kind of need to map out, how am I going to get everything in place? Who am I going to partner with? And all those kinds of things. And then last, because healthcare is always in a challenging time, like look at all the challenges that some of the PCP groups have had, or hospitals are having financially, or, Medicare driving changes for payers and things like that. If you don't have, a vision of a big goal that's really going to impact the organization, you're probably not going to get the support from your company or whoever your client is. And then they're going to expect you to be able to show the results that matter to them, as Lynn said, not your marketing results. So, and I know everybody out there is in a completely different kind of companies. We saw the list, all kinds of different companies. I'll bet your companies are in different stages of where they are with all of this. What's the pain points in the company, what, the boards are driving as the priorities. It's all different, which is why when we look at this, it always starts with the client's particular areas of focus, needs, and capabilities. There's not a cookie cutter approach. A lot of this work is custom to, your particular market and goals and things like that. So that ends the prepared comments, as they say, and we're happy to take questions here in the last 10 minutes or so.
Wonderful. Yeah, well, thank you both. This was a very thorough presentation, and we did have some questions that came through. So, without in no particular order here, I'm going to go ahead and ask this. First of all, how long after implementation will you start to see value?
Yeah, generally right away. Depending on the circumstances, it could take, 2, 3, 4 months to get everything set up and launched. The implementation period, that's hooking up the data and building the strategies and the campaigns and things like that. But once you're starting to communicate and connect processes, you should start to see value right away. Now the value curve will grow, as you add more use cases and campaigns and you optimize things. So, it'll build and build and build. And I always thought, because I've seen this in a lot of different places, once you have your infrastructure in place, which is your people, process, technology, and you're adding use cases or market segments or geographic markets or whatever, your speed to value is tremendous, and your costs don't go up very much. And so, that spread between the operational costs and the values, tremendous. And, if a client came to us and said, hey, we need to run a program on X, and the data's in there, we can probably have a campaign, full blown campaign with all copywriting and imaging and segmentation in maybe a week, maybe two, depending on the complexity. And then it's out and it runs every day as your data refreshes. So that's the beauty of it.
Great. Yeah, awesome. Next question here is, if we are an organization that hasn't done activities like this in the past, how hard is it to get started?
Well, so I guess the question here is the company is not operating this way, does not have a scalable database healthcare engagement process. How hard is it? Well, it's I'm not gonna lie to you. It's pretty hard, I think, because you need to involve, your IT and data groups. You need to invest in certain types of technology, and it's very hard to find the right team, talent that knows the business of payer and provider, what's important, knows how to work with complex data sets, knows how to use marketing automation tool, and as a marketer, you know, um, at the end of the day, this is a data market process. So when, we've seen and supported a lot of companies that have gone about this journey from different starting points and, sometimes mostly building, sometimes mostly partnering. The build is a long strategy, people do it all internally. Um, but the key, I guess, is to drive value and make progress along the way. Don't wait for a big bang, perfect solution. But I would say in most big companies, it's probably a couple of years to get from, once you're started to where you've got something that's pretty sophisticated and scalable. That's why, a lot of companies partner this out because it's not, database marketing is not their part of their core business or expertise.
No, that's great. Yeah, that's honest expectations. It's always good. Next question here is, uh, what type of patient demographics do the statistics on the engagement challenges slide represent? Maybe need to go back to that slide to take a look, or unless you know what he's talking about.
Well, we look at it from every segment. We look at Medicare, Medicaid, the market segments. We look at chronic, multi-chronic versus healthy. We look at male versus female. We look at Hispanic um, so we really try to look at it each cuts. But of course, I think as everybody knows, the sicker you are, the older you are, the more engaged you are, which is a good thing. If you're young and healthy, you don't need to be, engaged uh, too much. But, one of the things Lynn talked about is, if you're in a high need priority patient or member of a health plan, you may get 10 communications across the year for different purposes and different channels with different messages, different calls to action, different value propositions. And so it's the cumulative effect of all the communications and all the channels
Hmm.
that drive those engagement results. What we see is a lot of health plans will send out, you know, get your flu shot, a generic message, get your flu shot one time in a postcard or something. We never really see those work very well. You know, uh, Maybe for that use case, it's fine, but generally it's multiple communications and multiple channels with a high focus on priority patients.
Okay, great. We have time for a few more here. So if you have a question, go ahead and submit it now. If we don't get to yours for some reason, again, someone will reach out to via email afterwards. Next question here is, just understanding an ecosystem is hard, as it could be across vendors. Any suggestions on how to do this?
Yeah. First of all, start with a sensible architecture. If you can do something with 4 or 5 companies, don't get 10 of them. Every time you have another player in the mix, you've got more complexity, more expenses. So get your core ones, try to stay away from tons of little point solutions. Um, and then second, you've just got to get hooked up to their data. If you can bring their data in and push it out, now you're starting to connect things. And then people always say, you have to have aligned incentives. You have to have a forum for collaboration and problem solving, an operating committee. If everybody's disconnected enough, charging after their own interests, you don't really have an ecosystem. You just have a grouping of companies that are doing their own their own thing. So you need somebody, if those vendors are part of, or that ecosystem's part of a business process, you need a business process owner, somebody who looks across all of it and is the boss, so to speak, and setting priorities and all those kinds of things. So it's probably up, along with the technology and the data, it's really a human element problem. You just got a lot of people with different points of view doing different things that you got to corral.
That makes sense. All right, moving right along here. Next question is, can you talk about engaging multicultural segments?
Yeah, so that's a big deal for us because we have a lot of members, health plan members and patients in areas like Miami, Orlando, areas in Texas, South Florida, things like that. Um, as everybody knows for many years now, it's not an exercise of translation. That's the first thing. You have to understand the population, the subsegments, it's not Hispanics, it's, different countries of origin and all of that. And then your communications and your knowledge of what's going to resonate has to be pretty deep, and everything from images to channels to, you know, value prop has to be in culture, you know. And then if you send them in culture to a call center that can't take a call in Spanish, oops, you're not going to be effective. So you've got, if you go to your website and it's just English, you know, oops, it's not going to work because you're driving them to the end. And so, a lot of times people do some say, different language in the front end, and then everything in the back end is not ready, and with the growth and diversity in the country, in most places, that's a big gap if you don't have that ability.
No, no, that's very important. Uh, Last question for today is the segmentation, in the segmentation, do you establish personas to differentiate the consumers?
Yeah, Lynn, why don't you take this one? I've been talking too much.
Sure. Yes, we have, and we're currently working on a new one for one of our clients. But yes, we have the segments broken down. We try to look at, you know, your value, if you will, and your engagement. So are you highly engaged or you're not engaged at all? There's a continuum there. And then crossing that with how's your health status in terms of how much care do you need? So those are kind of two big drivers that we look at to try to put everybody on, if you will, on the spectrum and a specific clustering so that we can then personalize those communications and create journeys specific to the different ones. So there might not be a different journey for everyone. Honestly, it would just get too it gets too much to manage.
Sure.
But really, those chronic patients that need a lot of care that are engaged can be treated very differently than those that aren't engaged. All the communications need to be different. The channels need to be different. You have to choose. All of our clients have budgets, so you have to work within your budget to make um, the most happen that you can, and you need to spend the money where it's really, really needed. And so that's where the segmentation for us really comes in, because it dictates how much the the client can put forth in terms of resources to try to get those patients either in the door or get care gaps closed or you get their HbA1c under control, all those things. Some people are going to do it on their own. Some people need a lot of help. And so if we can identify those different segments of the population, then we can work with the clients to make sure we enlist all the right channels to get those done in the most efficient way possible.
I think
Wonderful.
we're at time. Yep.
Yeah, we are out of time, unfortunately. That said, hey, thank you so much, Lynn and Craig. This was a fantastic presentation. As we close out, I wanted to encourage you all to head over to vbcexhibithall.com and check out the Lucerna virtual exhibit booth there. There's a lot of great information about them, some resources that they have available. You can read up on what they're doing in the space. There's a lot of really neat things there. And of course, be able to contact them and get a hold of them there. And then finally, if you would like to reach out directly to our speakers today or to the Lucerna team, feel free to do that. John Wagner's information here is on the screen, and he'll be able to send you in the right direction. But thank you all so much for joining us today. Again, you will receive a email soon with a link to the recording and to the slides. So thank you all so much for joining us, and we will see you next time. Bye-bye now.
Thank you.
Thanks, Garrett.